Okay, we're going to go ahead and get started. Thank you so much for joining us for our Lobby Day webinar. This is a great opportunity for you to learn more about the bills that we're going to be advocating for on Monday and learn a little bit more about how the day is going to be structured. So we've got a bunch of folks who are going to be participating and helping me lead this webinar. So I'd love to go ahead and do a round of introductions. I can start. My name is Ashley Crocker. I am the Communications Director at Progress Virginia, and I'm really excited about our lobby, well, both our webinar and our lobby day on Monday.
Hi, everybody. I'm LaTwyla Mathias. I'm the Digital Director here at Progress Virginia. I'm going to be assisting everybody on the webinar, just kind of monitoring the questions as they come in. Feel free to drop a question in the Q&A or in the chat box, and we'll get to questions then. Thanks, guys.
Hey, hi. Sorry about that. I was going to say, hey, this is Michelle Woods. I'm the Communications Director at NARAL Pro-Choice Virginia. I'm excited that you all will be joining us for Lobby Day. It's going to be great.
Hey, everyone. Hi, everyone. This is Ray Pickett. This is the Communications Director for Virginia League.
Hey everyone, it's Monica. I am the community organizer here in the Richmond area for the campaign for a family-friendly economy here in Virginia. And I am excited to have everyone with us.
Hi there, my name is Sarah Flores Shannon, and I'm a field coordinator with the Virginia Latina Advocacy Network.
Great, I think that is everyone. So I'm gonna toss it to Monica to do a quick overview about security on Monday. And then we're gonna dive in to some of the bills that we'll be advocating for and the talking points and all the things that you should be telling legislators when you meet with them on Monday.
All right, yes, so on Monday, it will be very crowded. It's going to be our lobby day and it will also be a lobby day for other groups. So just one, be prepared for long lines, be aware of your surroundings, use the buddy system. We will have an increased law enforcement presence. So, you know, if you see something, say something. If something doesn't seem right or there's anything that you need to report, please utilize the law enforcement that is there, no matter how minor it may seem. And like I said, just please be self-aware, be aware of your surroundings. And like I said, if you see anything, just report it. We are all there to lobby for very important issues, but your safety is also it should be a top priority, and it is. So I just want to make sure everyone is aware.
Great, thanks, Monica. I think that's really helpful for folks to be aware of that there's going to be so many long lines and a lot of police presence. Now I'm going to ask Ray to go over the bills that we're going to be lobbying for and talk about why we're advocating for these 4 bills in particular.
Great. Thanks, everyone. So I'm really glad that we're all able to talk about this stuff today. As some folks have mentioned, Monday is a really big day. If you've not been to the General Assembly yet this week, it's going to be pretty hoppin', pretty crowded, and it's a really exciting time. So as much as we talk about the threats to reproductive health, rights, and justice, to the threats to our communities, and to the battles that we're constantly facing, there are a lot of things to be hopeful about in Virginia. And so the biggest thing that we need to do as advocates on Monday is to take those stories and take that with us into these meetings. One of the big things that we want to address, and we want the General Assembly to address, are reproductive health, paid family and medical leave, reproductive health in an equity lens, and maternal mortality prevention. And so the ways that we think that these will be accomplished are through some specific legislation that will come eventually, that will do things, roll back onerous and some laws that that make it nearly impossible for people to access abortion in Virginia. We also are really cognizant of the fact that, like lots of other states across the country and across the South, Virginia faces a serious dilemma where we need to decide if we're going to be leaning forward, if we're going to be moving forward on abortion rights and access to reproductive rights and healthcare for everyone, or if we're going to keep going backwards. And so the bills that we're going to be talking about are the things that are going to help move Virginia forward. One of those is the Reproductive Health Protection Act. The crux of this and all of the other bills that we're going to be talking about is that we believe that everyone deserves access to abortion care, regardless of their circumstances, their zip code, their ability to pay. We believe that everyone who wants to have a healthy pregnancy and a healthy baby should be able to do that. And we also believe that ensuring that everyone is able to balance work and caregiving responsibilities, this is what's going to ultimately lead to a better, safer, healthier Virginia. And so that's why some of these topics that we're talking about tonight, there are lots of issues that the coalition covers and discusses, but these are really the things that we're going to focus on for Monday. And with that, I think I'll turn it back over to Monica.
Yep, Monica, if you could take the lead on the paid family and medical leave bill, that'd be great.
Sure. So paid family and medical leave, everyone should be able to balance community and work. So it is very true. What our bill would do, it would establish a paid family and medical leave program here in Virginia to provide up to 12 weeks of paid leave benefits to workers who need to leave or need time away from work when dealing with their own health situation or family member, care for a loved one, an elderly loved one, a child. When having a new baby or adopting a child, there are various reasons why people may need time from work. Self-employed people would be able to also benefit from this program. Our bill would establish paid family and medical leave. It would provide up to 12 weeks of funded benefits, cover 80% of a worker's wages with an annually adjusted cap. It would be financed by small contributions from both the employer and employee. And it would safeguard working Virginians through job protected leave. I just want to make sure that people know this is different. This is separate from sick pay. This is not sick pay. This is not sick leave. This is different. And I also want to make sure people understand that not everyone has access to paid family and medical leave. As of right now, only 50% of white working people have access, 43% of Black working people, and only 25% of our Latinx community working people have access to paid family and medical leave. So this is something that would benefit all Virginians, not just the worker, but also the family. So it's extremely important that we get this passed.
Great, thanks so much, Monica. Now I'm going to toss it to Michelle to talk about the Reproductive Health Protection Act.
Thanks so much, Ashley. So the Reproductive Health Protection Act, we're really excited about it. It's being sponsored in the House by Delegate Charnel Herring and in the Senate by Senator Jennifer McClellan. And it basically gets rid of and rolls back the terrible anti-choice restrictions that have been on the books for quite some time. So some of those restrictions, for example, are the forced mandatory ultrasound, and we know that that's medically unnecessary, it's unethical and demeaning. For many women and people seeking abortion care, it's not medically necessary. Another provision that the bill includes is getting rid of the 24-hour mandatory delay when someone seeks abortion care. So we know that a lot of times the 24-hour delay extends far further than 24 hours, as it requires someone to make an appointment and then return home and get there and make another appointment that's at least 24 hours later. So it causes unnecessary delays. But when you talk to legislators about this bill, it's important to talk about how it disproportionately harms patients with the fewest resources. So those who have to plan for childcare, maybe they suffer lost wages with the 24-hour delay. They have to find transportation or potential hotel costs if they're traveling a far distance and coming from maybe a rural community out to a health center somewhere else. So it often burdens and harms low-income patients, young women, rural women, women of color, and is something that is an outdated restriction. Another item is another measure that we're trying to roll back is the bias counseling within this bill that's not based on medicine and not based on fact. And then one new item in this bill is that we're trying to get rid of the physicians only measure. So the current law requires that abortion care can only be performed by physicians, which blocks qualified advanced practice clinicians. Despite their rigorous postgraduate school or the clinical experience they have. And we know that advanced practice clinicians would improve and expand access to quality healthcare. And a lot of times, especially for those living in rural communities, they can access and already access advanced practice clinicians in their communities and already receive gynecological and prenatal care from a nurse practitioner or an advanced practice clinician, and that this would in fact expand access to healthcare closer to home for a lot of folks. So those are some of the really important measures in the bill, and like I'm sure we'll get into later, it's really important for you to talk about when you on Lobby Day how these measures might affect you or might be helpful to people you know. And how people around Virginia deserve for these restrictions to be rolled back. And then Ray, did you want to add anything about this bill too?
I think, Ray, you are on mute, but are you?
There we go. Sorry about that, friends. Michelle, you did a really great job of laying that out. And I think ultimately what this all comes down to is what kind of Virginia do we want and what kind of Virginia are we fighting for? Because the one that exists right now is full of a lot of onerous, burdensome rules and regulations that are not based in medical science or fact that are really harming a large majority of Virginians who need access to reproductive health care, including abortion care. And so when we're talking about these restrictions, it's really important that we talk about the real life impacts of these things, like Michelle was laying out. Coming back time and time again, going to the doctor 3 or 4 times, taking 3 or 4 days off work, going back and forth several times, getting an ultrasound that's not medically necessary and invasive. So this is why it's really important for us as advocates to bring our stories and our pieces to these sometimes wonky pieces of legislation. So I would just lift that up as well.
Great, thanks so much, Ray and Michelle. I'm now going to toss it to Sarah to talk about the Reproductive Health Equity Act.
Great. So as mentioned, this is the Reproductive Health Equity Act, which we also sometimes call REA. So essentially, REA would mean that it is this big visionary piece of legislation that would establish this comprehensive insurance coverage for a full spectrum of reproductive health services. So when we talk about a full spectrum of care, that includes family planning, so contraceptives, that includes abortion, postpartum care. It also includes cancer screenings for all Virginians. And I think one part that makes this bill really unique is the all component of this. So that means regardless of your income, regardless of your immigration status, regardless of your gender identity, and regardless of the type of insurance that you have. So currently, depending on what your immigration status is, even if you are a visa holder living in the United States, you may not qualify for programs like Medicaid or marketplace insurance programs. And so therefore, when you're trying to access contraception or just go to your local reproductive health care clinic, you could have to pay an extremely high cost out of pocket. So for me, one thing that I had no idea was how expensive some of these services can cost. And so what we found, kind of with what Michelle was mentioning before, we know that these really high costs of medical services really impact low-income communities, communities of color. And one other community that we do mention when we talk about RAIA is the LGBTQ community. So one other really great and unique part of RAIA is that there is a transgender non-discrimination policy. So that essentially means that, for example, if a trans man needs to go and have a cervical cancer screening, he will not be denied care because his gender marker says male. And so these are really important services that we believe that everyone should be entitled to. And so there's just another component in this bill that allows for that kind of protection. And so, as I mentioned, I think one other component that I touched on a bit is just the immigration aspect. You know, we really don't want to create this two-tier system where people are discriminated against because of where they come from. And we also want everyone to be able to live and work with dignity and respect. And that means saying that we trust people, that they are going to make the best decisions for themselves and their families, and that the type of insurance that they currently have doesn't matter. If they don't have insurance, that doesn't matter because they are still entitled to this kind of care. So we are very excited about this particular bill as well, and I'm happy to answer questions at the end if any of you have them.
Great, thank you so much, Sarah. Now I'm going to talk a little bit about a new package of things that we're going to be supporting. And this is actually not a bill, but a couple of different budget amendments that would help prevent maternal mortality, the maternal mortality rate in our country. As you may have heard, there is a maternal mortality crisis, and our maternal mortality rate is significantly higher than in many other developed countries. So this is a real problem. And the package of budget amendments that we are supporting includes expanding Medicaid coverage for new moms from 60 days to 365 days postpartum, because a lot of times after a woman gives birth, there are things that can happen after that 60-day period that comes from the pregnancy and birth, but may not appear before that 60-day cutoff. And we want everybody to be able to have the best postpartum care that they can get. So by expanding the postpartum Medicaid coverage to women for 1 year after they give birth, that gives them the option to go to the doctor if they're feeling like something's not right. And if they need more services, they don't have to worry about paying the bill at the end of the day. Another budget amendment that we're looking at that is part of this maternal mortality package is increased access to contraception, including long-acting reversible contraception like IUDs. And then also we're going to be exploring the possibility of Medicaid reimbursement for midwife and doula care for pregnant people. And this is just sort of the first step in addressing the maternal mortality crisis. I think there's a lot of things that could and should happen, but we're excited to support these things in the next couple of weeks, because really all of us should be able to choose to have an abortion, should be able to choose to be on birth control, but also when it's time to start your family and have a baby, we want people to be supported in that as well. Unfortunately, right now, because of racism and white supremacy culture, it's much more difficult for Black women in our country to have babies. Black women are discriminated against by their doctors. They have a more difficult time accessing abortion and birth control, and they're dying at unprecedented rates when they have babies. So it's time for us to come together and really address this crisis in a really serious way. And I'm excited that that's something that we're going to take on as part of our lobby day. So now that you know a little bit more about the bills, I just want to talk generally about what our expectations are for Lobby Day, because we certainly don't want you to feel like you have to go in there and talk to legislators about all of the facts and figures. What is most important during Lobby Day is to talk about your personal experiences, why you've decided to take time out of your life to come to Richmond and talk directly to your legislators, whether that's because you have personal experience with one of these bills or because you just feel that strongly that these things are important. We want to make sure that you're sharing your personal story and leading with your values rather than feeling like you have to know all of the answers to all of their questions, because that's not really your role. That is the role of people like me and our organizations to make sure that legislators have the facts. But what we need from you is to just share your personal story and your passion and make sure that legislators know that you voted them into office to pass bills like this. So with that, I am going to open it up for questions. If you have a question, you can type it into the chat box or the Q&A box, or raise your hand and I will unmute you, and you can just talk to us. No questions?
Hey,
I'll give you a couple more minutes.
This is. I just want to add at the end for the maternal mortality rate, to add how paid family medical would actually help that as well, lower the maternal mortality rate, by ensuring that both parents, parents would be able to be home, mom can heal properly, by having someone in the home with the mother, also making sure that everything's okay. Like I said, when you have a baby, the people, if someone's with you, lives with you, the people that is around you notices differences, sooner than other people. So like I said, by having both parents in the home able to have paid family and medical leave, would actually help. It would help with the mental stress. It would help with the physical burden. It would just help all around and help strengthen that. So I did just want to add that paid family medical leave does intersect with lowering the maternal mortality rate.
Yeah, thank you, Monica. I think that's a really good point and something I definitely should have mentioned. So thank you. So we have one question here that says, is there going to be a handout, one pager or something with information on the bills for Monday? And yes, absolutely. Everybody will receive a folder with all of the fact sheets for all of the bills. You'll have things to leave behind for legislators, and you'll have all of the information that you need to tell people what the bill does and be reminded in case you forget, because I know we just threw a lot of information at you. And then the other question we have is, who would provide the comprehensive insurance coverage for Rhea? Sarah, do you want to take that?
Yeah, so I believe that it would be under a plan, and Ashley, you might know better than me, but it's called Plan First, I believe, in Virginia. So Plan First currently is Virginia's free family planning program. And so it's I believe that Plan First kind of falls underneath the like larger Medicaid umbrella, but it would be a state program. So for example, so I have insurance through my work, but I would still be able to then qualify and receive free reproductive health care services if I lose that insurance, or even with the fact that I do have insurance, these services would still remain free. And so one thing I also just want to touch on with Rhea is that this is a monster of a bill. To say that you're going to guarantee that everyone in the state, regardless of immigration status, regardless of gender identity, regardless of income, is able to receive a full spectrum of care, it's going to be, you know, we really see this as like a visionary bill. And yeah, so Ashley, I don't know if you have anything else that you want to add about that, but to answer the question in short, it would be under Plan First.
Nope, I think that is correct and right, and I don't have anything to add. Does anybody else have questions? Those are the only ones that I've seen in the Q&A box, but I'll give people just a couple more minutes in case you want to type something, or if you want to raise your hand, I can unmute you and you can use your voice. Okay, well, I don't see any more questions, but if you do have any questions, feel free to reach out to us and we'd be happy to answer them before Monday. We are so excited for an amazing lobby day. I think this is going to be a really wonderful session. We are actually going to get some things done, and I'm really looking forward to seeing you all on Monday. Thanks so much, everyone.